Now, as we already talked about what is Meniere's disease and what are the causes of Meniere's disease, now let's go and talk about what are the clinical features of the Meniere's disease and how it presents. So the main clinical features of the Meniere's disease is vertigo is very, very common, and this is a spinning sensation which the patient feels with the Meniere's disease. Then hearing loss is common, and as we already mentioned, the hearing loss is not the conductive hearing loss, it is mainly the sensory neural hearing loss in Meniere's disease. Then besides these two, vertigo and hearing loss, some other common features are tinnitus, which is the ringing sensation in the ear, that's common. And then nausea and vomiting and falling is also very common. Nausea and vomiting, as with any other condition, lot of people they feel this nausea and vomiting when they move, and it's also known as like a motion sickness. The same mechanism is involved as in vertigo, because that's the spinning sensation, and in motion sickness they have that spinning sensation that leads to nausea and vomiting. So that is also common in patients with Meniere's disease, besides vertigo, hearing loss, and tinnitus. So Meniere's disease is a disease in which males are affected more as compared to females. So male patients are more with the Meniere's disease. There are the cardinal symptoms of Meniere's disease include episodic vertigo. There are episodes of vertigo in this. Sometimes patient feels perfectly normal, but there are episodes of vertigo lasting from just few minutes, 3 to 4 minutes, and then maybe up to some hours, but it's not very, very long, does not last for days. So there are episodes of vertigo in Meniere's disease. There is fluctuating hearing loss. This fluctuating hearing loss can ultimately lead to complete deafness or complete loss of hearing, but in the beginning it starts with fluctuating hearing loss. Sometimes hearing is better, sometimes it's poor. Tinnitus, as I mentioned, is the ringing sound in the ear, and it's very, very uncomfortable condition. Patients, they cannot sleep. They have all the time this disturbance and noise in their ear. Then sense of fullness or pressure in the involved ear. Again, this is very uncomfortable condition also. The patients always feel that they have something in the ears. They feel the ear full, and that's also like leads to hearing loss also, because of fullness. They cannot hear properly. So all these are very, very common clinical features present in patients with Meniere's disease. Episodic vertigo, fluctuating hearing loss, tinnitus, sense of fullness in the ear because of increased endolymph and pressure in the ear. The vertigo, if you see this picture, there is a spinning sensation. So they feel that like the room is spinning around them. If they are outside, they feel the trees and different things, depending on the environment in which they are, it's spinning around them. There is sudden onset which comes in attacks. So we already mentioned vertigo is episodic, so they have episodes of attack. So sudden onset which comes in attack. The attacks are episodic. There is vagal disturbance such as abdominal cramps, diarrhea, cold sweat, pallor and bradycardia also associated with vertigo. So these are all the disturbances, vagal disturbances when there is spinning, as in motion sickness, as I mentioned. These are all the symptoms associated with that also. Bradycardia is decrease in the heart rate. There is abdominal cramping, diarrhea, and cold sweat. Tullio phenomenon is present, and Tullio phenomenon is a phenomenon in which the loud sounds or noises produce vertigo. So it's the condition in which the patient is present in the environment where there are loud noises, they can have this attack of vertigo. Due to distended saccule lying against the stapes foot plate. So this Tullio phenomenon is mainly due to when the saccule become distended, which is the otolith present in the vestibule, it pushes against the foot plate of stapes that leads to Tullio phenomenon. Then the hearing loss, fluctuating hearing loss, improvement in hearing, but there is distortion of sound and intolerance to loud sound. So fluctuating hearing is present, sometimes it's better. Even with the improvement, there is distortion of sound, and in the loud environment they are intolerant to loud sounds. So patients should avoid the areas where there are loud noises present. Other features, as I mentioned, there is some other features present is nausea, vomiting, there is sleep disorder, appetite disorder associated with Meniere's disease also. Tinnitus, sense of fullness or pressure, then the nausea, vomiting, abdominal discomfort with the vertigo, sleep disturbance, appetite disturbance, all these things can be associated with Meniere's disease. So that was all about the clinical features of Meniere's disease. Thank you for watching sqadia.com.